Welcome to the course Drug-Induced Psychosis in Adolescents, Recognition, Differential Diagnosis and Management in Australian Clinical Practice. This program is designed to provide a comprehensive overview of how to recognize, assess, and manage drug-induced psychosis in young people using evidence-based guidelines relevant to Australian practice. Over the next hour, we will explore the latest clinical approaches, practical tools, and key safety considerations that can help improve outcomes for adolescents at risk. Who should take this course? This course has been developed for a wide range of professionals involved in adolescent health and mental health care. It is particularly relevant to general practitioners, adolescent mental health clinicians, psychiatrists, and psychiatric registrars. It is also intended for emergency department nurses, mental health nurses, school counsellors, and psychologists. In addition, alcohol and other drug clinicians will find the content directly applicable to their work. If you are involved in assessing, supporting, or treating adolescents with possible drug-related mental health presentations, this training is for you. Why this course matters. Adolescents who present with acute psychosis require urgent attention and careful clinical judgment. Distinguishing between substance-induced psychosis and primary psychotic disorders such as schizophrenia can be complex, especially when substances like cannabis or synthetic cannabinoids are involved. In this course, you will learn to identify early warning signs and red flags, follow Australian clinical guidelines for assessment and intervention, and manage acute presentations effectively. We will also cover how to engage young people and their families in sensitive, non-judgmental conversations about drug use and mental health. By the end, you will have greater confidence and practical skills to reduce the risk of misdiagnosis and mismanagement. Module 1. Understanding Drug-Induced Psychosis in Adolescents. In this first module, we will define drug-induced psychosis and review the diagnostic criteria set out in the DSM-5 and ICD-11. We will compare key features of drug-induced psychosis with those of primary psychosis, so you can recognize important differences in onset, duration, and symptom patterns. We will examine the most common substances associated with adolescent drug-induced psychosis, including cannabis, methamphetamine, synthetic cannabinoids, and hallucinogens. Finally, we will look at Australian prevalence data and explore emerging trends in adolescent substance use, so you can place your clinical encounters within the current local context. Module 2, Neurobiology and Pathophysiology. In Module 2, we turn our focus to the brain. You will learn how psychoactive substances alter brain chemistry and trigger psychotic episodes. We will explore the vulnerabilities of the adolescent brain, including ongoing development of the prefrontal cortex and dopamine pathways, which contribute to greater susceptibility. We will discuss the mechanisms behind cannabis and synthetic drug-related psychosis, and why these effects can be particularly severe in young people. By the end of this section, you will understand why adolescents are more prone to drug-induced psychosis than adults. Module 3, Clinical Assessment and Differential Diagnosis. Module 3 provides practical tools for clinical assessment. We will outline how to conduct a thorough history, covering the substance use timeline, psychiatric history, and family history. We will highlight key points of the mental state examination specific to suspected psychosis. You will learn how to use collateral information from family, school staff, and peers to build a clearer picture. We will identify red flags that may suggest a primary psychotic disorder rather than an acute intoxication effect. Finally, we will review validated screening tools and questionnaires commonly used in Australian clinical settings. Module 4. Acute Management and Risk Mitigation. In Module 4, we address the priorities in acute care. We will begin with immediate safety considerations, whether in the emergency department or a community clinic. You will learn about pharmacological interventions, including when and how to use antipsychotics and benzodiazepines. We will also explore non-pharmacological strategies, such as calming techniques and verbal de-escalation. The session will cover safe management of agitation and aggression, and how to access referral pathways to mental health crisis teams within Australia. Module 5. Recovery, Follow-up and Relapse Prevention. Module 5 looks beyond the immediate crisis to long-term care. We will examine the prognosis and recurrence risk for adolescents who have experienced drug-induced psychosis. You will learn strategies for engaging young people in ongoing mental health support and the importance of family psychoeducation. We will discuss harm minimization approaches and the role of early intervention services, including school-based supports. This section will also cover how to develop relapse prevention plans and monitor for any transition to primary psychosis. Module 6. Case Study and Clinical Application. In the final module, we apply the course content to a real-world case. You will be introduced to a 17-year-old male with suspected cannabis-induced psychosis. We will walk through the assessment process step by step, outline the management plan, and consider appropriate follow-up. This case will show how to apply Australian clinical guidelines and best practice approaches in a practical, realistic scenario. Learning outcomes. By the end of this course, you will be able to define and differentiate drug-induced psychosis from primary psychosis in adolescents. You will recognize the key clinical signs and patterns of substance use linked to psychotic episodes. You will be able to apply evidence-based assessment tools in Australian settings and manage acute presentations both safely and effectively. You will also know how to implement relapse prevention strategies and connect young people to long-term support services. CPD Course Assessment. After the course, you will complete a short quiz to check your understanding. The questions will cover diagnostic criteria and differentiation between drug-induced and primary psychosis. You will also be assessed on your knowledge of risk factors, neurobiology, acute and long-term management, and Australian referral pathways. Certificate and CPD credit. Once you have completed the course and passed the assessment, you will receive a digital certificate of completion. This certificate confirms that you have achieved 1 CPD hour in drug-induced psychosis in adolescents. Recognition, differential diagnosis and management in Australian clinical practice.